Hi, and thanks for watching today. So my name is Glenn Forbes. I'm a PhD student at the Robert Gordon University in Aberdeen, Scotland. So I work on the Fit Homes Research Testbed, which is run by the Alban Housing Society. It's also partly funded by the Data Lab Innovation Centre. So the Fit Homes Research Testbed is quite a broad research area. We have many projects running in parallel, but FITsense is one of our initial projects, and that's which I'll be detailing today. So this work's a high-level summary of the research challenges that we faced in presenting automated healthcare insights to smart social housing residents. So just to outline what I'll cover today, I'll detail the background of the project itself and some of the research that drew us into that area. I'll then give an overview of the data pipeline and how we generate profiles of our residents. We'll then cover how we highlight health risk factors and then how we can present that to residents, carers, and family members. So this project is centered around an installation of 16 purpose-built smart houses just outside Inverness in Scotland. And these houses contain many simple internet IoT sensors, and they're actually currently live right now. So just to reiterate, there are real people living in these homes right now with this system running live. And so these sensors are simple infrared motion sensors and magnetic door sensors, and they're widely available, fairly standard sensors. And since the resident has no personal interaction with these sensors, they are completely ambient. So most of our residents have remarked they completely forget about them. And our approach allows us to avoid privacy concerns, which are common to more standard approaches, such as like wearables and video. And this has a profound impact on resident uptake. So we interpret resident behavior using activations from the sensors and assemble these behaviors into resident activity profiles, which can then be tailored to highlight different areas of health. And the FITsense project, this one, focused on identifying an early risk of falling in residents. So of course, as a one-year project to develop an applied system, we knew the work was going to be in some ways limited, and we faced quite a few challenges which shaped our approach. So in an ideal world, we would aim to use like a data-driven machine learning approach to sensor data interpretation. However, that requires fairly significant amounts of data. And of the smart home sensor data sets that we investigated, the median duration was about 2 weeks. So to get labeled sensor data, we needed to communicate with the residents of the homes. And for many reasons, this was quite a rare occurrence. We asked a small number of residents to keep a diary in 15-minute intervals, logging their room and behavior. And you can see an example of this on the right here. This was limited to 2 days per resident due to a variety of limitations, it's mostly just fairness on them. And this meant that the data that we had became really useful for performance insights, but rather than sort of data collection for actual modeling. So this drove us to develop a rule-based activity recognition system with plans to adapt a machine learning-backed system moving forward. And so the sensor modalities in the system were also quite limiting, which meant that we knew that we were going to have to perform activity classification through more high-level assumptions than normal activity classification. And these challenges informed much of the direction of the project, and it highlighted the potential scope for the system. So knowing this, we investigated similar studies which acknowledge these limitations. And our first major insight was the sheer prevalence of passive infrared motion sensors and their binary nature. So as far as activity recognition is concerned, these sensors are massively limited. A single binary sensor activation can be indicative of quite a wide range of activity with significant ambiguity. So the same sensor activation might indicate that you've walked to the other side of the room or that you've been jumping up and down in place. And so this limitation, it does draw some comparisons to a high standard for activity recognition, which would be accelerometers. And these poled sensors produce far more data than the event-based infrared sensors. And as a result, the approach that we took to working with PIR data should be more high level. So we should be looking at a greater intent rather than the actual action. We also looked into the process for diagnosing long-term health risks, such as cancer, dementia, and fall risk. And these are highlighted through hospital testing, where key factors are measured and then compared to relative standards expected for a patient. However, these procedures can be quite inconvenient for residents, especially those in remote or rural areas, like the ones that we're working with. And so our work, we aim to perform a facsimile of these tests in order to highlight whether additional investigation is necessary. So this diagram here is a brief overview of the FITsense system, going from our raw sensor data to produce resident activity profiles. So individual sensors, such as these ones here, are linked to specific rooms and functions. And these can then be, we can then split these activations into smaller sequences, which can then be recognized activities. And then features extracted from these activity performances can then be assembled into our resident profiles. So we colloquially refer to it as the tartan, because the diagrams end up looking quite similar to Scottish tartan. And these profiles can then be potentially compared to the resident's previous profiles, other residents' profiles, or even benchmark profiles of residents deemed to be at risk. So having outlined the approach and the limitations, we ran some experiments with early sensor data to get a feeling for regular resident behaviors. So this experiment here shows the paths that residents took moving throughout the home over a 24-hour period. So these lines show the residents' paths as they move through the home, which became darker on repeat travels. So if I start that out here, you can see the most common path that we end up identifying almost always is the path from the living room down here into the kitchen. And so this gave us a bit of perspective on the residents' daily routines and how we could focus these assumptions that we were making of their behaviors. So these behaviors, they're synonymous with individual actions. And these activities that we can infer from the basic behaviors will then inform the complexity of the insights that we can make of our system. So our activity recognition is broken down to 3 different stages. So we have our raw sensor data, which you can see here at the top right, and the purple indicates when the sensor is activated. And then this time stream needs to be segmented into smaller sequences of sensor activations. And then once segmented, we can analyze the shorter sequences for activity labeling and then feature extraction. So the most important aspect of this work is segmentation, as it sort of allows us to infer just how much raw data we can actually take from these raw sensor activations. Once again, we consider the differences between our sensor data and that of an accelerometer. So poled sensor windowing methods are quite different to that of our event-based sensors. So accelerometers may typically be used of half-second to 1-second windows, whereas our approach uses variable length windows, which can vary from 30 seconds to about 5 minutes. And as a result, these windows are significantly larger, which reinforces our insight from earlier that we should be considering the high-level intents of the person. And as such, we chose to segment behavioral sequences by room. So in this example on the right here, you can see the resident is in the bedroom, and then they move into the bathroom, and then they activate the flush sensor before moving back into the bedroom. The flush sensor remains activated for quite a long time, just due to the design. And so I'd like to think it's quite clear what happened here. So we can segment this activity as the sensor activations which occurred just in the bathroom. So it's a room-based approach that we use in our rule-based system. And these observations, we can back these up with our path tracking experiments and also the resident data annotation that we had done earlier. So then these activity performances are then assembled into our resident profiles. And so our profile representations, they can vary quite slightly depending on our perspective, but they're largely built from the activity performances and the extracted features therein. So for instance, this profile on the right here is formed from the daily activity breakdown by time. So from this, we can observe regular daily routines and slight variations. So the characteristics of individual and summative performances can be extracted as features. So the time taken, the presence and absence of activities. So for instance, this resident didn't leave their home that day. Now that we have the profiles, we can then, we understand how we can interrogate them to generate our health insights. So our foundation for this work was based on a literature review we performed highlighting fall prediction indicators and common research in that area, as well as our discussions with healthcare professionals from the NHS and adjacent authorities. So on the right here, we have an example of metrics which are checked when considering the risk of cardiovascular disease. And you can see here, they consider shortness of breath, weight changes, irregular sleep, etc. like that. And so we exhausted our own list of similar features which we could highlight through the FITsense system. And after this, we were able to link some of those to fall risk. So we settled on sleep time, sleep quality, so considering disturbances, how many times they get up during the night, things like that, overall activity level, and wandering behavior, so moving between homes of no real actions, and also toilet use. So highlighting those factors, we now need a metric that we can use to perform comparisons between one another. So we chose to score the residents' performance in these factor areas in a directed linear scale. So by scoring between 0 and 1, we can ensure residents that understood that a score closer to 0 would indicate poorer performance and vice versa. And this is important as the feature values being extracted may vary in their positive directions. So for instance, if our system detected a high number of sleep time disturbances, this should yield a low sleep disturbances score because a high number of sleep time disturbances would be bad. So these scores are generated using fixed thresholds, which were agreed with healthcare professionals as previously mentioned. This is an initial system, and the next stage of the system, we're aiming to generate adaptive thresholds with machine learning using the residents' previous performances. These scores are then compared to that of a benchmark risky profile, and this risky profile is an example of a resident who scored quite poorly in each category and would be considered to be at risk of falling by the healthcare professionals that we worked with. So these scores are generated once a day and presented in a radar chart like these ones here. This one here, sorry. The resident can then access their profiles through a secure online dashboard, which they can then choose to share with carers and family members. So let's just take a couple of look at examples just now. So here we can see an anonymized resident's activity breakdown for a full week. So we can see here their sleep time varies quite significantly, so increasing towards the middle of the week here, and then decreasing again. A few of these days, the resident left their home, which you can see in the black here. So our residents have been, and their family members too, have been quite receptive to these chart types, and they find solace in being able to view changes in their daily routines over time. And here we have a resident's fall risk profile. So we can see they're not in the risky category. They don't make into this orange barrier anytime here. They have good scores in quite a few important areas. So their sleep score is quite strong, as well as their sleep disturbances and their room transitions. However, their overall activity level is quite low, and it's almost bordered into that risky territory. So it's something we would be able to highlight with the resident, and certainly the resident should be able to see that. So the idea is that residents can view this and work with their carers and family to inform future decision making to hopefully mitigate these deficiencies, or at the very least highlight it for a medical professional to further investigate. The work's still in quite early stages of evaluation. However, we're seeing residents gain quite real insight into their own behaviors. So that's quite a solid foundation for fostering their confidence in long-term independent living. So thank you very much for your time. I'd be very happy to answer any questions.